Hi, my name is Melissa Martinelli. I'm an occupational therapist and lymphedema therapist at AquaCare in Lewis, Delaware. I want to thank Kate and the Cancer Support Community Delaware for having me here today to talk about a topic that I'm very passionate about. So this is part one of a two-part series on healing after breast cancer. So today, the part one is actually a discussion about post-surgical tips and then the benefits of therapy on your healing journey. So I'm going to go ahead and share my screen and open up my presentation here. Okay. Let me just start the slideshow here. Okay. Can everyone see? Just perfect. Okay. So let's start with our first slide here. So this is our team, actually. I feel very fortunate after relocating here in the last 8 months to the Rehoboth Beach area to find a very skilled, amazing team in Lewis, Delaware. Our AquaCare team is a trio of us 3 women here. Jillian's lovely. She is our occupational therapist and lymphedema therapist as well. And then we have Lane, who's a physical therapist and a women's clinical specialist. She's also a lymphedema therapist. So you have the 3 of us here locally to service your needs when it comes to oncology rehabilitation, as well as lymphedema management. So I just want to start with some objectives and review some basic breast cancer statistics and medical management. Then we'll talk about, after that, more general precautions, expectations, activity guidelines, but then also some signs and symptoms of possible complications, something where therapy would be potentially helping on your healing journey. But then also learn about the benefits of early engagement in therapy. And then at the end, we're going to do a couple exercises through video instruction. So that way, if there's any specific questions that you have, at least we can get started with some of the exercises. So basic statistics here for breast cancer. In 2024, it actually was estimated that over 300,000 new invasive breast cancers would be diagnosed, and 16% of those individuals would be less than 50 years old. So we do see a large population here in the Lewis area that fall within the primary region of ages 50 to ages 80. We have all different patients that come in, all different ages, all different stages, all different types of cancer. So one of the other things that we want to make note of too is that less invasive cancers like ductal carcinoma in situ, actually, there was almost 60,000 cases within the last year that were anticipated to be diagnosed among women. The other thing that's worth mentioning is almost 3,000 cases actually were diagnosed in men. So since moving to this area, I've actually seen an influx in male population that are in survivorship after breast cancer. So I think it's definitely important to make mention and note that as well. So how are we doing our medical management for breast cancer? There's several different types of therapies that you could be receiving, both at the same time or preoperatively, or surgery first or after surgery. So today we're going to focus primarily on the surgical aspect of medical management, but I do think it is important to mention all of the other therapies that you may incur as you go through your survivorship. So surgery can include something like a lumpectomy, which is where they actually remove a portion of breast tissue where the cancer is located. You may also hear this called as a segmental mastectomy or a partial mastectomy, even though it's not full. You can also undergo a full mastectomy, and there's all different variations of that, where they remove. A simple mastectomy is just removal of all the breast tissue and tumor formation. You can have skin-sparing mastectomy, where most of the breast tissue is removed, but there's skin or nipple sparing of the region. And then there's modified mastectomy, where you actually are taking more than just breast tissue, but also some of the lymph nodes in the region of the armpit. And then a radical mastectomy is actually less common these days, but it was previously many, many years ago where there would be a lot of invasive disease and they would take muscle, tissue, all different types of breast material and around the truncal area, and it had much longer recovery. So you can also opt to undergo any reconstruction at the time of your surgery. Sometimes it's an immediate reconstruction using a partial, like an implant or an expander implant with a plan for a second stage surgery to transition to implant. There is also actual reconstruction that's related to just using your body's own tissue to reconstruct a breast. And then when your doctor's doing your surgery, they might also sample lymph nodes. So one of the type of lymph node biopsies is the sentinel lymph node biopsy. This is where they would inject a dye right around the nipple. That dye would travel to these first guardian lymph nodes, and those would be the lymph nodes that would be sampled in that particular surgery to see if there's any presence of cancer cells. An axillary lymph node dissection is when there's actually more lymph nodes taken in the region of the armpit. So sentinel lymph nodes tend to be 0 to possibly 5 lymph nodes. Anything above that likely is axillary lymph node dissection. So when we have patients that we see, it's good to know what kind of surgery they've had. That way it gives us an understanding of what risks, in terms of possible complications or any risk of lymphedema. And also knowing exactly what they're going to be doing as far as their additional treatments. So you may or may not also undergo chemotherapy, as I said before, either pre-surgery or after surgery. You may also undergo radiation therapy, which I feel like is a lot of times where our surgeons are referring to our clinic, is that our patients will come in, they might have limitations in their range of motion of their arms, and they need to get into radiation position. So a lot of times we're seeing them and helping them to get into their next stage of their treatment. Other therapies could include hormotherapy or immunotherapy, and alternative therapies such as acupuncture. And then we fall in line of the supportive therapies, so occupational and physical therapy, as well as psychosocial counseling and nutritional counseling services as well. So what can you expect after your breast surgery? So depending upon whether or not you have drains in place, a lot of times after a full mastectomy, you'll have drains in place located on the torso area. So in that case, if they're there, they're likely to be there for a couple weeks, and you would be under precautions. And that means really not lifting the arms much above shoulder height. You want to stay below what we would consider 90 degrees of reach. So this below shoulder height and hands close to the sides, and where you're really not doing anything that's going to overextend above, where you have to do your daily life skills. And then other restrictions could be, depending on your surgeon, they could put you on a restriction of anywhere between 5 to 10 pounds of no lifting. And at this point, when your drains are in place, you really, really want to avoid any sort of repetitive or resistive activities. Vacuuming, gardening, etc. Excessive like laundry. This is the time for your body to heal. So if you have loved ones or support persons in your life, let them do these things for you. As other things that you might have a precaution is to either wear your post-mastectomy compression bra. If you have expanders or have opted for certain types of reconstruction, your doctor may or may not advise wearing any sort of compression. But a lot of times after mastectomy, we will see patients that are wearing some form of compression to help facilitate healing. So other things to expect. I think it's important for our clients to know that after this type of surgery, depending on how invasive of a surgery it is, you may have limitations in your range of motion, whether you have drains or you do not. The other thing to consider would be that your muscles might be tight. You might have some spasms. You might feel generally weak or fatigued. That's also considering the fact if you had chemotherapy prior to your surgery. So then surgery couples on another element of fatigue in your recovery. The other thing to expect, and I really feel like this is an important area to talk about, is the difference between post-op swelling and lymphedema. So many times I have patients that come in that might be only a couple weeks, still maybe have drains in place or shortly after their drains come out, and they say, I'm swollen here, this is lymphedema. Honestly, you're in a situation where your body's just undergone trauma. And when your body undergoes trauma, you're going to have swelling. So it's important to come into therapy so we can track this and get a true sense on your initial evaluation. How much swelling is there? What are the characteristics of this swelling? Is it truly lymphedema? So this way you can have your specialist guide you through, is this traumatic from your surgery and it's just going to take time for the body to heal and reduce some of that swelling through some interventions? Or is this something that's going to be more longstanding, like a chronic condition like lymphedema? The other things to expect, I would say, would be some pain. using different tools, removing tissue, your surgeon, your doctor, your medical team, you should be in close communication about your pain levels, especially if it's affecting your sleep. So I know a lot of people don't like to take something for pain, whether that be prescription or over the counter. But if it's really impacting your ability to do your life skills, your quality of life, these are the things that I would talk to your medical team about and see if there's anything that they can do, whether it's holistic or medicinal, just so that way you feel more comfortable as you're healing. Other things to expect: scar tissue. So the area of scar tissue where they actually remove portions of the breast or the whole breast, whether you have both breast removes, it depends on how much scar tissue and how your body forms scar. Other things to expect would be either loss of or diminished sensation to that area. So keep that in mind when it feels like, say, like numb. Sometimes people will say they'll feel tingling. This is normal, and over time, either some of your sensation may come back, there might be limitations to the sensation ongoing. So that's something I would also ask your doctor about, what to expect based on the type of surgery you have, if you'll have full sensory return. So some of the things that I'd like to talk about are complications after breast surgery or syndromes after breast surgery that you might experience. This is considered axillary web syndrome, or you may have heard the expression cording. So cording actually causes what feels like a cord underneath the armpit area. So it can happen after you've had lymph nodes removed into the armpit or breast surgery. It can happen or occur after radiation, and it definitely can be seen or felt. So looking at this picture here, sometimes we'll notice that there's cords right in the armpit region, sometimes right at that little curve at the elbow. Sometimes we will say they'll feel it go all the way down to the edge of their wrist on the side of their thumb. And it causes this tightness, painful sensations, or sometimes like people describe it as like electricity or like an electric shock when they go to reach. You can also have cords that extend down into your torso, which are considered Mondor's cords. A lot of times people say, I had no idea what it was, but I felt something under there. And we see a lot of clients in our clinic, and it's very treatable. It's something that can occur shortly after surgery. It can, like I said, occur after radiation, or it can flare up. And it can persist for weeks to months, sometimes even ongoing, depending upon the amount of scar tissue you have. So if you're noticing something like this and it just isn't getting better, please ask your doctor, because we can treat this and we can help improve range of motion. We can help limit some of the pain and improve just functional reaching ability. So people always say, well, what is that under my arm? There's a lot of research that's mixed to say, is it venous in nature? Is it lymphatic in nature? And what we're finding is it's caused by inflammation and almost scarring of some of these vessels that are involved all intricately underneath the arm and throughout the arm. Subacromial pain syndrome, or you may have heard of the expression frozen shoulder. So this occurs when the structures around the rotator cuff become irritated and painful. A lot of times with some range of motion restrictions, or we do a lot of guarding after this type of surgery, it can freeze or almost impinge some of those tissues around the shoulder. Then when we're allowed to start moving again, it makes it much harder, or you might feel pain located on the back side of your shoulder or on the side. So this also can limit your range of motion. And a lot of times when people are coming in, they'll say, it's really uncomfortable if I try and sleep on that side. So that's something to consider too. We give our patients under these circumstances different exercises and stretching techniques in order to really help get their range of motion back. Other possible side effects to consider would be a seroma. Sometimes after removal of breast tissue, you can have a fluid-filled pocket underneath the skin after the surgery. You might feel sensations of like a fullness, tenderness. It might even feel like a little bubble or, round presentation. And this can be scary. People feel something different in an area of their chest when they've had, breast cancer. They say, is this something that's recurring? So when something like this comes up, I always refer my patients back to their doctor just to have an examination and make sure that if it is something that can be either aspirated to relieve some of that pressure, or if it's not causing really any discomfort, then it might just be something that, is monitored ongoing. Other possible side effects could be infection. So this would present as redness, warmth, or maybe even pain. You may or may not have drainage from an incision site, or you may or may not have fever associated with that. Infection or risk of infection or even questions of this is considered more of a medical emergency, and you would want to talk to your surgeon if you were experiencing any of those symptoms. Other things would be scar tissue adhesions, and this can restrict a lot of your mobility and make things really sensitive and tender. So it's important that when your doctor gives you the clearance to start mobilizing some of that scar tissue and touching it again, a lot of my patients after the surgery are having a hard time even just looking at their chest area in the mirror, let alone touching it. So the therapy that can come in suit with this really can help desensitize some of that sensitive tissue and help to alleviate some of the discomfort. So the other complication, either before surgery, after surgery with breast cancer, could be lymphedema. So lymphedema is more of a protein-rich swelling of the arm, hand. It could occur in the breast area, chest wall, and even in the torso or back. So a lot of times this type of swelling could be described more so as a heaviness, an achiness, a fullness of that limb or part of the region. You might even notice, and then again, you might not notice any changes in size in your arm or region that you're experiencing some discomfort. So the other thing that is a highlighting feature is some of the skin and the tissue texture will change. Our skin tends to be, very soft, very supple. And in situations where we're getting fluid that's accumulating in that area, you may see what's called pitting. And that could leave an impression or indentation from your clothing, from like a bracelet or different things. So there's a lot of information on lymphedema and risk reduction and how to manage this type of condition, because many times you don't see swelling initially. It might just be the sensation of that. So we're going to talk more about that in the part 2 portion of Healing After Breast Cancer on March 18th, that one. So please join us for that if you have more questions about lymphedema specifically. So the early impact of therapy. There has been several studies on the impact of therapy. This one specifically is from Klein and their team. And it really highlighted for me the importance of early therapy. So there was an intervention that started for 157 women in their study, and they were assessing their pain and disability levels. They started on post-op day 1 and gave them exercises and asked them to complete them 3 times a day at a very minimal rate of 5 repetitions per exercise. And then they would actually follow in with phone calls at 1 week and 1 month. Now, this isn't someone attending clinic. This is someone that's, receiving exercises while they're in the hospital after their surgery and then getting check-ins. So what they found, they also were given information and education on pain management and then daily function, and then when in complications to seek physical therapy. So the findings are really interesting because the treatment group overall reported reduced pain levels throughout the process, and also increased functional performance in their daily life at a shorter time frame. And the other highlight to this is that by participating in some of the exercises or engaging in physical therapy, none of this at which increased any cause of complications of seroma or bleeding. So it actually helps or may help to facilitate healing by just engaging in your exercises and early therapy. So how early therapy can help. The research is pointing towards trying to have our patients come in pre-operatively. So this way, especially our patients that are at higher risk for some complications, especially lymphedema, we can establish a baseline measurement. So when you come in early for therapy and do an initial evaluation before your surgery, we take measurements, all the way up the length of your arm. We'll take chest measurements, we'll take torso measurements. We'll also see what available range of motion you have, knowing that our bodies are unique beings and we've lived certain chapters of our life, may have had injuries in the past, and we have to consider these things. Are we going to achieve the same range of motion that we had before, knowing that we may have had an injury to that same area? Possibly, possibly not. So it's nice to get an idea of someone's medical history and coming in early, so we're considering all of these factors moving forward. It is a great opportunity coming preoperatively to receive education on how to monitor your symptoms, go over your precautions. What clothing should you wear? Many times I'll tell my patients, make sure you're wearing comfortable clothing, something that's buttoned up, something that's easy on, easy off, and also give them different information on how to position themselves for comfort, but also to help promote good trunk extension and make sure that they're doing everything that they need to heal comfortably. The other thing that coming in early to seek our therapist support is really just another person, right? To run ideas by, to ask questions to. And I really think that is what's wonderful in the aspect of therapy is that we can serve as another support to your medical team in your care plan. Also, I really want to emphasize, let your family members, let your friends, let the people that are offering to help to really help. And it's okay in these moments to ask for help. Your body's healing. It's been through a lot. And I really feel like we see other people go through other surgeries, whether it be like a knee replacement, joint replacement, different things like that, and they receive help and they do therapy. And it's not the standard of care right now to be receiving therapy after, mastectomy consistently. Not everyone gets referred. So it's important just to make acknowledge of that, like your body's undergoing so many different changes. It's very personal. And if you need additional people there helping, then please feel free to give us a call for a consultation. And then relying on your community-based programs too is really helpful. So the Cancer Support Community of Delaware, Unite for Her, the Delaware Breast Cancer Coalition, all really wonderful resources. So if you were to come in post-surgically, we would do a reassessment once the doctor said it was okay to be seen. So at that point, we would reassess your range of motion, strength, sensation, make sure that, everything was moving comfortably. We also at this point can take new measurements of your circumferential, meaning like over your new measurements for your chest or your abdomen, your arm. We want to monitor your pain and give you more education on how to, manage your pain and then monitoring of your healing surgical area. You'll also receive, after your surgery, an introductory home exercise program. This is to help improve your range of motion, decrease pain, reduce your fatigue, and prepare for radiation, let alone also getting back to your daily life skills, which is most important. This is also a time where when I have patients come in for a new evaluation, we share a lot of information. And just yesterday, in talking with one of my clients, she explained to me that prior to her surgery, she was having a lot of different falls and getting dizzy. This was a great time for me to say, have you ever considered having physical therapy? Do you have history of vertigo? We're going to go over all of your medical history, and that gives us an opportunity to really say and streamline your individualized care plan. Like, do you need a referral to a different practitioner in order to really help you meet your goals, reduce your safety risks, and help you heal at your best? The other thing that we'll do is we'll screen for all of the things we talked about today in terms of complications. And then we also at that point can assess your need for compression garments. So at our clinic, we actually custom fit for sleeves, gloves, torso garments, all the different garments for management of lymphedema. So if you do have any compression garment needs or compression bra needs, we can actually place orders through additional durable medical equipment vendors, but we can size you for those as well. So what will you expect when you come into therapy? You can expect that we're going to have you do some exercises, which will consist of gentle guided strengthening and stretching. And then we'll also be working essentially on your core and upper body strength. We start to, once you're ready, to do additional cardiovascular exercise. Sometimes people prefer to do it in clinic when they're coming in for their session. Some people just like to have guidance to do something outside of the clinic when they're at their home. Maybe you have a home gym or access to a gym, or you really just like walking outside, doing some general exercise. And sometimes I hate saying the E word. It's really just more about moving your body. It's a wonderful place to start, and we're here to guide you and encourage you to do that. The other thing that you might have needs for would be either soft tissue or joint mobilizations. We do trigger point release, which is like a massage technique. Scar massage, we usually won't start scar massage until about 4 weeks out from your surgery. And that obviously is going to be dependent on how your incision is healing. We also do manual lymphatic drainage to help mobilize fluid from congested areas. And we do a lot of diaphragmatic breathing work to help stimulate the central lymphatics and help with relaxation, pain reduction, desensitization, and sensory re-education to the area, which I touched on a little bit. Also activity analysis, postural education, sizing and fitting for compression garments, and then self-management education. We really touch on a lot of different topics. And I always tell my patients, I'm like, if I'm giving you too much information, just tell me to stop. So I really try and help design a program based purely on what my patients' individual goals are. And I feel like we have a very successful program going for us. So here's a little quiz, right? So some of the pictures, what's good versus poor posture? Anybody have any ideas looking at picture 1 on the left side versus picture 2 on the right side in terms of healing after your surgery? Say I just had surgery and now I'm relaxing on the couch watching my favorite movie or TV show.
A comment in the chat said the right one is better.
Yes, yes. And then any reason why?
Better circulation.
Yeah, that's definitely part of it. Anybody else have any comments about? So I'll X this out. Yeah, this is not the one that you want. When you look at the picture over here where I'm like curled up in a ball, our bodies have this natural instinct to guard and protect. And what happens is your shoulders become rounded, everything is flexed inward to your body, and that can create limitations in your range of motion overall. If this was the position, I'm not saying don't ever do this. This is comfortable for a lot of people, but trying to get yourself in a position when you're relaxed, where your ears are aligned with your shoulders and your hips, you have this open presentation of your chest wall while still maintaining your precautions, not going above shoulder height, especially if your drains were in place. It just allows, like our guest said, it helps with circulation, it helps lymph fluid flow, but it also helps relax tense muscles to reduce any limitations in range of motion in the near future. So I've included a picture of our youngest daughter in our laundry basket, as comfortable as she is laying there in a ball. It probably isn't the best posture, but it sure was cute to see. All right, second one in standing, good versus poor posture. What would we say without being too obvious?
Um, Erica in the chat said left is good.
Mhm.
Irene said the same, left is better.
Yes, that's correct. So when you're looking at the second one, what you're seeing, remember what I said in terms of posture. What gets really tight in this area is the area of the chest wall after having mastectomy. So you want to work against gravity pulling you forward. So many of my clients that come in after mastectomy and breast surgery come in with this appearance, where their shoulders are rounded forward, their head's poking forward. It really comes from a lot of weakness of the core and the upper back muscles. So we work a lot when someone's ready and they're in a good position of position of healing, that we can start doing exercises to focus on strengthening those areas, and ideally aligning where your ears are aligned with your shoulder, with your hips. So that way we all technically should be standing like this or sitting like this. But as we're sitting at our computers right now, looking at the screen, rounded forward, when we text, when we're on our computer, everything comes to the front of our body. So as much as you can, you try and correct how your posture is, and that'll help you in the long run. So we're going to go into some basic exercises. I have a couple of videos to share with you. Let me get to my main screen here. Sorry about that. There we go. So here's a video if you were to have drains in place of some basic exercises. I always make note that it's important to do neck range of motion. You have a lot of lymph nodes right around your neck region. So just gentle tension in those up and down, right and left, turns is really important. You'll see in the next slide, I usually will start this also with some deep breathing, but making sure you're working all different range of motion of the neck, adding in some internal rotation of the arm. And then I know it seems very simple because we use our arms all the time, but bending and straightening the elbow and then going palm up and palm down really helps just mobilize some of that area of the arm. And it our muscles act like little biological pumps to pump fluid. This one's especially important. It helps to rotate our shoulders to the outside of our body and expand our chest wall. Obviously, you're going to do this to a point of comfort. I shortened some of the repetition of the exercises just for timing of the video, but you can do some of these exercises anywhere from 5 to 10 times. And it just should help in situations where you're feeling like your muscles might be a little bit more tense. The next one is in a lying position. Now I'm on a yoga mat on the floor. You might not be able to get to the floor at the time. You can do this absolutely by laying in the middle of your bed, or if you have to do it one-sided, by laying on your couch, if that's what's most comfortable. I'm just doing some diaphragm breaths right now. So on the breath in, my belly's rising up and then down. And then this is a really nice stretch. If it's comfortable, it's expanding the chest wall, extending both arms out to the side. And sometimes you might not be able to start in that position. You might just be able to start in this position where your arms are down at your sides and your palms are facing the ceiling. Then gradually working up to this T position and then a Y position. Obviously, you wouldn't have your drains in place and do this one, but as you're healing, this is a nice one to start. Active motion exercises in this plane. I call these snow angels, especially in the snowy time of year that we have right now. And everyone kind of gets that image, right? Being a little kid in terms of doing a snow angel in the snow. Unless you're not from the area and you never had snow. Yeah. So, yeah. And then reaching arms overhead, interlocking your hands. And you can hold that stretch, anywhere from 10 to 15 seconds. This one's just elbow flaring and extending your arms outward. And then gradually working your way to arms behind your head. If you can, sometimes you just start right on your forehead. And then this is more of an activation exercise where you're bringing your elbows inward and then expanding your chest wall. And then transitioning to a sideline position. This one's a little bit more of an advanced exercise. A lot of my patients, several weeks after their surgery or even maybe a month after their surgery might not be comfortable in this particular position, but we work up to it. So this one's really nice. I call this one the open book. Let's see. And then I have one more. As you're gradually working to standing, and you could even start some of these once your drains are removed. This would be still a comfortable position if you had drains in, but then as you go above shoulder height, you can extend all the way up. Doing this as if you had a one-sided mastectomy, but you could also add both hands in the, both if you've had both breasts removed, and then working all the way up. And then if you have something, I usually say if you have like a cane or an umbrella or a golf club, or in this case, I have my Swiffer, you can use something with a long handle that's lightweight to just help guide your arm up. This is a great one to do, especially if you've had cording. You can also do this one lying down. You do not have to do it standing. Okay, let me go back to our slides. Oops. Let's see. And then slideshow, third slide. Okay. So general closing remarks would be really just discuss your care plan with your medical team and consider if therapy is right for you, whether that be pre your surgery, pre-surgery, post-surgery, or even several months after your surgery. Keep your team informed about how you're healing and that journey and any concerns you have. Your medical team, your oncologist, your surgeon, they're going to be following up with you for several months and years, depending on what additional medical management you may have. So any time is a good time to tell someone if you have specific concerns or even just general questions. A referral to therapy early in your recovery might actually reduce your risk of post-surgical complications. And we really want to emphasize the importance on general movement. Move your body after your surgery, obviously within your restrictions and precautions, and work your way up each day to doing a little bit more to your comfort. And then obviously having good posture, and be prepared to make slow and steady progress, especially if you have additional treatment after your surgery. I always want to emphasize this to people because I feel like so much of my clients really just want to be at a certain spot where they're back into their regular routine. And it's going to get there. It's going to be your version 2.0. It's just going to take the time. So being mindful of giving yourself the grace of saying, I'm just going to take my time with this, focus on my healing, and then you'll be great. You're going to do wonderful. And then this is us again, just our team. So that's me at the top, Melissa Martinelli. I did include my email here as well as our office location. We have 2 locations in Lewis, one on King Street and then another location in 24. Jillian and myself were primarily at the King Street location, and then Lane actually is a few days at each location. So if that services your needs in terms of what you need locally, then you have the 3 of us to take care of you. And we look forward to seeing you at your initial evaluation.